Okay, let's see. Good afternoon, Dr. Zeller. Thank you so much for taking the time out of your day to come on here and chat with me. I know it was your day off with your kids, so that's very much appreciated. So, welcome on to the podcast.
Thanks for having me, Brittany.
Absolutely. So, everybody, just so you know, this is a super special episode for me because I love Dr. Zeller and her and I work collaboratively on a lot of cases. So, I'm super pumped to have her on here and I can't wait for her to share your story with you all because she rocks. So let's get started. Let's first talk about like your aha moment, right? We all in the field of airway, no matter what role we play, all have that aha moment. We're like, oh wow. So let's start with that if you want to share about that.
Yeah, so when you first brought that up, I was trying to think of one moment. And what I think is actually amazing is everybody talks about airway as this rabbit hole, right? So you start learning and you have that first moment where you're like, oh, wow, airway. Like that is related to the mouth. That is the teeth. That is everything that I look at all day long. And you think you've had that moment. Then all of a sudden you talk to somebody else and you start to learn a little bit more. And then all of a sudden it's like, oh, wow, there's my next aha moment. So, for me, I started just by learning about obstructive sleep apnea and thinking that that was the pinnacle. So we learn obstructive sleep apnea, we learn make an oral appliance for it, pull that jaw forward, get the tongue out of the throat, and you will cure the world. Well, then you start to learn that, wait, there's a lot more going on there. So not only can we treat obstructive sleep apnea in adults, but wow, we can actually identify this in a kid. And now that's an aha moment for me. But it's more than just teeth and it's more than just airway. It's muscle function, it's foundation. And every time that I hear somebody new talk and every time I pick up something different, whether it's about how this begins or what the underlying symptoms are, it's really another aha moment every single time. And I think that's what's so cool about this is that I don't think you can ever know everything. You have to keep digging and digging and digging and see where this hole takes you.
Yeah, right. I feel like we are forever lifelong learners because just when you think you know it all, which we know we don't know it all, but just when you think like, yeah, I'm there, and then you're like, oh man, now there's something else for me to learn. And which is,
Yeah.
kind of like you said, it makes it super exciting. And right, we're already passionate about our careers. Like you loved being a dentist, I loved being a hygienist, and now to be able to add this specialized field and consider yourself, an airway dentist. And for me, being in myofunctional therapy, I didn't think I could get more passionate about my career. And like, it's just a whole new level and it doesn't ever stop. It just only gets better.
Yeah, one of the first courses that I took, the gentleman who was teaching it, and it was John Tucker. He's awesome. Great introduction to all of this stuff. And what he said is that the eyes can't see what the mind doesn't know. And I'm sure he was quoting somebody else, but when you think about it, it's so true. You don't know anything until you do. And then every patient that you see, you start understanding why this is more than just about keeping their teeth clean. This is more than just about filling a cavity. This is more than just putting a beautiful crown or veneers on those front teeth, or even just making them straight. It's about understanding why everything is happening in their mouth, taking a way more holistic approach to everything that you're doing, and putting everything into an airway focus and an airway lens and understanding everything from there.
Absolutely. So let's talk about, kind of how your role might have changed. I mean, you do orthodontics in your practice, but let's just say, recommending a patient for their first orthodontic eval. So like let's talk about why even like 7 years old is too late.
Yeah, so I was just having this conversation the other day. So my partner, the gentleman who I work with, is actually my father-in-law. He's amazing. And he has been ahead of the curve for this kind of stuff forever. And so, he's up there in his 60s. And when he first started practicing ortho, it was insane to start looking at kids before the age of 12. Well, he was ahead of the curve. He started looking at kids around the age of 7 and 8 years old. And he's been doing that for so long. And I said the other day, I said, wow, the curve has really shifted because now looking at kids at 7 and 8 is too late. We want to be looking at kids when they're 3, 4, 5 years old to start noticing, because you look at a 3, 4, 5-year-old and they're in for trouble down the road. Mm-hmm. It breaks my heart when I talk to parents and they're like, well, we knew from the beginning that this was a problem. And, we brought it up to so many people. They told us just to wait. Like, oh, all we have to do is wait because we'll treat them when they're older. Right. But yeah, why would you?
Like, follow your gut, like be an advocate for your child, follow your instinct.
Yeah. I mean, there's no other medical problems that we would just wait on. Right. I mean, you go to a pediatrician, you tell them, your child's having a fever, or, oh, let's just wait it out and see what happens. Like, we can treat that when they're a little older, whatever it is. And we shouldn't be doing that. We should be understanding the problem, finding the problem, and then figuring out how to treat the problem when we see it, not when we feel like it's the right age to do it.
Absolutely. And I love, I think it's like a direct quote from Dr. Ben Rally, who I know you're a big fan of as well as I am. I at least know I heard this from him, that unhealthy children lead into unhealthy adults, right? Like it's only going to follow you as you get older. And like for us, we're almost able to predict what their adult life will look like if we don't intervene earlier, don't get, earlier prevention.
Yeah. I mean, and to add to that, we know that kids are already 74% developed in the craniofacial region by the time they're 2 years old. So, I always tell parents, obviously your kid isn't born with a head the size that it is now. These things have to develop. Like, they would not be very fun for anybody. So these things have to grow and they have to develop, but it happens super fast, right? And by the time they're 2, 74% of that development is already done. By the time they're 12, they've already hit 98% of that development. So it's crazy. I mean, it's crazy to think about the fact that if we wait until they're 12 years old to treat, we have very little natural growth left. We've let them go through their entire growth spurts over and over again without taking advantage of them.
Right. Now let's talk a little bit about expansion. So, there's a lot of orthodontists out there who do maxillary expansion, but let's talk about mandibular expansion and why they're both important.
Yeah, definitely. So you'll hear orthodontists say, and this comes a lot from Dr. Moralia too. I want to make sure he gets all the credit for this. But you'll hear a lot of orthodontists that talk about the fact that maxillary expansion doesn't work, right? Well, there's a couple of reasons why maxillary expansion doesn't work, is because the maxilla and the mandible have to come together. And when those two things come together, they have to meet. You can't chew if your maxilla has been expanded nice and wide, but your mandible is still super small. Your teeth have to come together. And so when we say mandibular expansion, really what that is tipping of the teeth. And that's okay, right? You're not going to get a true expansion in the mandible. You're not going to get true growth of that thick bone. But what you will get is teeth tipping and uprating of those teeth. So in order for mandibular teeth to actually meet a small maxilla, they have to be tipped in like this. So when we straighten them up like this, we increase the amount of room that you have to actually expand the maxilla, and you make a more stable platform. And I think we're going to get to this a little bit later, but I would also say, I think one of the main reasons why maxillary expansion doesn't work is because for decades, we've never addressed the habits that have led to the need for maxillary expansion.
Absolutely. So I mean, we can jump, kind of right into that and talk about, I know you're obviously a fan of myofunctional therapy. We work together a lot on cases, but let's talk, about how important addressing those habits and the muscles are and the function.
Yeah. And I guess let me start by saying, so when I look at adults, so I see both children and adults, and I look at adults and for some reason lately, or just because that's the way it goes, I've seen a slew of patients who are for bicuspid extraction patients, and they all had their premolars taken out when they were kids because they had mouths that were too small. Should have been expanded, but instead we just took the teeth out. And now they're adults, and guess what? Their mouths are still too small and they're crowded all over again. So everything is still crowded, only it's crowded in an even smaller mouth than it was to start with. And to me, that is just screaming because we didn't address the problem. So the mouth was too small because we didn't have the proper function. And I was just reading this the other day. I thought it was really interesting. So it only takes 2 grams of force to move an anterior tooth, and the tongue itself exerts 500 grams of force. Okay. So if the muscles battle against the teeth, the muscles are going to win every single time. So I can put something in your mouth. I can make your teeth straight. If you still have that same habit where your tongue pushes against those front teeth with 500 grams of force over and over again, every single time that you swallow, those teeth are moving, period. I don't care if you put your retainer in every night. That's game over. If you have a poor tongue posture and it sits low and it's not sitting up in the top of the mouth where it needs to be to hold the expansion that we just did, that's going to collapse. We're not going to have the same expansion. There's no way. You build the space for the tongue has to sit there or else everything is going to collapse.
Absolutely. That's why we see so much orthodontic relapse, and the patients come in and they're like, but I've been wearing my retainers. Like, what's going on? It's like, well, your tongue is sitting in the bottom of your mouth. That's what's going on. Your tongue is basically your retainer. It's going to retain that development that you just did so beautifully. And that's why, again, we always stress interdisciplinary care. It's so important. We can't really do one without the other. We wouldn't be as successful as we are if we didn't work together. It's just so important. The other thing I wanted to mention was, if you want to talk a little bit about Healthy Start, if you want to talk about, even the expansion you've seen with Bax.
Yeah, absolutely. So Bax is my son. I have 6-year-old twin boys who are adorable, I think. And actually, yeah, well, I mean, a little biased, but I would say that they are more or less my reason for jumping into pediatric airway. So Baxter was frequently in the hospital. When he was 3 years old, he started getting croup probably monthly throughout the course of the winter. And every time he got croup, it was to the point where he was not able to breathe and we were calling an ambulance. They were putting him on oxygen and epinephrine on the way to the hospital, and then he was getting steroids. Mm-hmm. And we saw a number of ENTs, and those ENTs were all telling us that he needed his tonsils and adenoids out. He needed ear tubes, and it was going to be pretty much a lifelong issue if we didn't do that. Well, I'm always for the least invasive approach first, and that does not mean that people do not need tonsils and adenoids out. I want to be very clear about that. But I like to take a least invasive approach first and see how that works. And so I started learning about Healthy Start. And Healthy Start is a series of appliances, and I would say a whole mindset. So basically, we have to force the kids to breathe through their nose. Humans are obligate nasal breathers. And it's such a huge part of Brittany's practice too, is getting you to breathe through your nose. Your lips should be sealed and you should be silent when you're breathing. And so I heard that and I started looking around and I realized that there was not one time that my son had his mouth closed ever. His mouth was always open, always breathing through it. His tongue was always resting on the top of his teeth. And it was like this. So, I mean, that's exactly what it looked like. And so I went back, I looked at pictures, and that had started when he was a year old. I mean, even before that, he was drooling all over himself all the time with his mouth open, and I didn't know any better. So we started him in Healthy Start, and without fail, every morning his appliance was on his pillow. I would have him wearing it, it would fall on his pillow. I'd have him wearing it, fall on his pillow. And then I would say, thankfully, I met Brittany, and she started talking to me a lot about the myofunctional component of this and how if he really can't even get that thing in his mouth and hold it in his mouth, we really need to start strengthening the muscles of his mouth first, in addition to using this. And so we did that. We did a whole bunch with Brittany and myofunctional therapy, and he did all of his clicks and his exercises, and we were really good about it for a while.
He's a great patient.
We're trying. But yeah, and so all of a sudden his expander and his appliance started staying in his mouth overnight. And what this appliance does is it has a little shelf that helps to raise the tongue into that position that we were talking about, making sure that the tongue is touching the spot up on the palate in the appropriate way, and that there's no thrusting when they swallow, so it blocks that whole thing off. And also when their lips are sealed around this appliance to help keep it in their mouth, they can only breathe through their nose. So we established nasal breathing with him. And I would say over the course of about 3 months, I had gone from waking up every single night from the time my kids were first born until they were 5 years old. And now I have not been woken up in the middle of the night. And it's been almost a year, and I feel like a new person. So it's huge, but it's huge for him. I saw a huge difference in the spacing in his teeth. So he started to actually create gaps in his maxilla. His mandible started to come forward more, which is amazing to me. And there was no snoring. I go in their room now, when I go up to bed, I always just pop in to make sure everybody's okay still. And it's silent. It's silent in their bedroom, which is incredible. There's no screaming in the middle of the night. Every single night he would wake up having to use the bathroom. He doesn't wake up in the middle of the night anymore. There's no nightmares. And, it's almost like the miracle drug that you wanted. Right? Really, it's just addressing the problem. We addressed the underlying problem for all of this. And I think one of the coolest things for me is his tonsils were like, we grade the tonsils based on how big they are in the back of the throat. And he was about a tonsil grade 3, which, you know, is very, very swollen. When I looked the last time, and I just had him in my office the other day, his tonsils were definitely like a 1, 1, 2.
Amazing.
So huge, huge differences in pretty much his whole demeanor, his whole personality, and definitely in everybody else's ability to sleep through the night. So
Yeah, and still kind of staying on the topic, you know, of pediatrics and the importance of sleep. I mean, as a parent, it's got to be so important to know that your child's getting that deep regenerative sleep that they need. So that kind of brings us into the next topic I wanted to talk about, and the link between airway and things like ADHD, bedwetting, and so forth.
yeah, so I'm going to start with the ADHD link because I find this fascinating. So we know that 56% of kids who have been diagnosed with ADHD actually score positive on a sleep-related breathing disorder scale. So that's about half the kids that we're telling have an attention issue also have a sleep issue.
Mm-hmm.
We also know that those kids are less likely to respond to medication,
Mm-hmm.
right? And if we throw in one more little study, we know that the symptoms of sleep deprivation are very, very similar to the symptoms of ADD and ADHD. So with this crazy rise that we've seen in the diagnosis of ADD and ADHD and people who don't respond, I think one of the major questions that I always ask parents when they tell me that their kid has attention problems is, what other symptoms do they have? So if all of a sudden we're starting to tick off a ton of these boxes that relate more to an airway issue than strictly an ADD, ADHD issue, then maybe the first course of treatment shouldn't necessarily be medication, but it should be looking at that underlying cause.
Absolutely. I just had a patient, a new mom, reach out to me today. Her dentist had referred her because he's still doing a lot of clenching, grinding, bruxing at night. And he had his tonsils and adenoids out, or he had his tonsils out when he was 2, I think, and his adenoids shaved. He's 6 now, I want to say. And then I started asking her more about his sleep. And she's like, well, he doesn't sleep for more than 3 hours at a time. He's constantly turning, you know, sleep talking, sleepwalking, the whole gamut. ADHD, hyperactivity. So I was like, oh yes, we need to get a sleep study for him for sure. We need to know, you know, what's going on. We need to get him referred for, you know, I haven't seen him yet, so I don't know. But again, we're able to kind of build these pictures in our minds based off what we know and, you know, other clinical experiences that we've had. So I'm curious to see what comes up on that sleep study, and curious when he comes in to see exactly what he looks like as well.
Yeah, so it's funny that you said that, because with COVID now, right, and masks. So normally I have patients who come into my office for our first visit and they have their mask on, and I run through all my questions with them. I want to know, did you have orthodontics, and were teeth taken out, and you know, what other issues you have? What are your sleep problems? What are your breathing problems? Were your tonsils taken out? And I'm building this picture of what I think it's going to look like. And I still haven't seen their mouth, their smile, or anything now. All of a sudden, they take their mask off and I'm like, nailed it every time.
Like it's the big reveal. You're like, ready? 3, 2, nailed it.
Exactly. And without fail, every patient almost looks the same. And it's a narrow smile, super narrow. So when they smile, you can really only see canine to canine. And it's that longer facial growth. And a lot of times what you're seeing is a gummy-er smile. So the growth that should have been outward and forward and wider was misdirected because, again, we didn't have the right things in place. Either they had an obstruction in their nose, which caused this mouth breathing problem, and that was allowed to continue. And now all of a sudden we have a narrow palate, we have a setback jaw, and we're just going to pull teeth and shove everything in there and see what happens. Yeah.
And then we're going to end up with what we're going to be talking about next. We're going to have some TMJ issues going on as we get older.
Amen.
Right? Yeah. So let's talk about how then the underdevelopment of the jaws and basically everything else we just talked about can lead to TMD.
Yeah. So I don't know if you can tell, but I'm going to give you a big smile here. I actually have my Invisalign on right now. And one of the reasons that I'm doing it is for the TMJ problems. So I was fortunate in that my parents started me in ortho crazy early for a child of the 80s. So I was 8 years old when I started.
That's amazing.
And somehow, I know, right? And somehow my orthodontist let me keep all of my teeth, thank God. And I was put in an expander. but no one ever addressed the underlying problems. And I already told you, Brittany, I'm coming to see you pretty soon, but you'll see I definitely have a tongue tie. I mean, it's crazy when I now think about the way that all worked out. And so it relapsed and things started crowding. And when I turned 30, I was in dental school. You don't learn any of this in dental school. So like, while you're watching this, don't say, how come my dentist never brought this up? We don't learn this. You have to seek this out. So I'm in dental school and I say, oh, my lateral right here, and this one, it's a little forward. I'm just going to throw some braces on it, grab my local orthodontist and have them pop in a few brackets and we'll see what happens. Well, everything got moved back again. And now, most likely, because I actually do have a pretty bad retruded jaw, from even when I was a kid, I was never expanded enough. My jaw never came forward enough. Most likely I had the problem underlying already, but add into that the stress of being in dental school with twin boys, and now the grinding and the clenching and all of that comes to AAT, and I can't even read my children a bedtime story without my jaw hurting. Now that's crazy to me.
Yeah.
So one of the things that we know is the positioning of the lower jaw is determined by the upper jaw. So your lower jaw hangs free. The only things that are really holding it onto your entire face are your muscles. And the only thing that determines where it lands are your teeth. So if you have a narrow upper jaw, your lower jaw is trapped back. Now, if I trap back my lower jaw, then my condyles, which are up here, which want to be sitting high and forward, are being shoved backwards. So instead of having all of that pressure on the disc tissue, which is fibrous and it's prepared to take that, now I'm pushing on some of the more vascular tissue, the tissue with the blood vessels, the tissues with the nerves in it. My muscles are stressed out because my jaw is not in the right place. And all of that is cycling through to cause the problems that I was having. What I think is incredible is I'm on tray 3 of 15 now for my Invisalign. And the whole approach is wider and forward. Okay. Allow the maxilla to get wider and forward and pull the mandible along with it. And I can tell you that I already can make it through this whole conversation without wanting to throw an ice pack on my jaw. So that's a big deal.
Yeah. And I'm excited to come in and get going too, because, everybody thinks I'm crazy when I say it. Yes, I have beautiful straight teeth, but look how near I am. The excessive vestibular space I have, my smile's asymmetric. Like, sure, they're straight and they're white, but my airway, I want to also have a sleep study done because I wake up in the middle of the night with my heart racing at times. It's been better. I've been, having some, taking some supplements, magnesium and making sure I get enough vitamin D and, everything I'm supposed to be doing, zinc, all of that. But I mean, I'm narrow. Look, I see straight through. So I'm super excited to also get started with you. So we're going to tag team each other's cases together, which I'm super excited about. We'll have to document it along the way and have you back on the podcast, or we can do a live feed or something on Instagram or Facebook. We'll have to figure something out.
Yeah, it sounds awesome.
Right? That would be so cool. Yeah, both of our cases together. Is there anything else you'd like to talk about before we wrap things up?
I'm not necessarily. I think, we talk so often that it's funny because it's like, I always feel like we're on the same page about these things. It's incredible when you just hear some of the stories of parents who know that their kids have problems. And then, the wait and see it, wait and we'll address it later kind of philosophy. And then seeing where that ends up in the adult population. So I think that's really a cool part about treating the whole spectrum, from kids where you can make a difference, to people and a lot of the patients that we do this expansion on, or at least in my office right now, are in their 20s, 30s, 40s, early 40s. And then waiting until since I still do a lot of oral appliance therapy, hitting those people in their late 70s and early 80s and seeing that it's not only a spectrum of the disease, right? But it's the spectrum of comorbidities that go along with it. And it's incredible to think that by just addressing the airway, and I say just, but it's the oxygen, it's the way that your whole body functions, right? By just addressing this underlying problem, we can take these children from pools under their eyes, long facial growth, mouth breathing, nightmares, bedwetting, ADD, ADHD, and turn them into healthy adults, not adults that need to go through medication and high blood pressure and everything else. It's just heartbreaking.
Shortening their life expectancy, right? They
Yeah.
say it takes like 10 years off your life being airway compromised. And patients sometimes, and I'm sure you see this a lot, they don't even know, because how would they? It's all they know. They're 70 years old and they lived with everything that they have. They don't know what it feels like to breathe better, so it's almost incredible. And I'm sure, you would agree that it's so rewarding when they see, the positive impact and the results, and they're like, wow, like, I wish I did this sooner. Yes, but hey, thank God we're doing it now, right? We're adding on years of your life.
Yeah. And again, it blows my mind when I get somebody who's in their late 70s, right? And you look in their mouth and you just know they have an airway problem.
Mm-hmm.
No. Okay, well, how do you feel when you wake up? Well, come on, we're all tired. It's like, well, no, we shouldn't be.
Right.
I mean, we shouldn't be, right? I woke up from sleeping for 8 hours. I should feel good. I shouldn't have a headache. I shouldn't feel like I need a nap. It shouldn't take me 3 cups of coffee to get going. And just because that's I would say common doesn't make it normal, and it doesn't make it correct. So
absolutely, 100%. Well, thank you so much, Dr. Zeller, for coming on here, for taking the time to come on here. We're definitely going to have you back on. We'll record, like I said, our collaboration together, which would be awesome. And yeah, thanks again for having on. As always, I think you're absolutely awesome. So keep rocking it.
The feeling is mutual.
Aww. Women empower women, right?
Yeah.
All right, everybody. Thank you again, Dr. Zeller, and we'll see you later.
Bye, guys.